Often people with a substance use disorder have been through a lot of pain, a lot of unresolved trauma. They have fear, they have anxiety, they're depressed. Scottsdale Providence Recovery Center offers a myriad of services. Each client typically will see 2 to 4 individual therapists a week at Scottsdale Providence Recovery Center, depending on their needs, whether it's trauma therapy or neurofeedback or their primary therapist. They'll participate in family therapy. Some of the ins and outs of, neurofeedback can really help somebody who's got anxiety, for example, actually identify and see their body's reaction to certain stimuli, and then learn that while I'm applying this coping skill in real life, I can watch my body get less anxious. At the same time, I can feel that result, which then reinforces, use this coping skill in the future. We don't want to get people well just while they're at Scottsdale Providence Recovery Center. We want to teach people how to stay well when they leave treatment and practice the skills they learn while they're in treatment. When someone's going through trauma therapy, EMDR, eye movement rapid desensitization, helps that person take this traumatic experience or this traumatic memory or this traumatic series of events, which, if you think of the word trauma, it creates a crater. It creates a dent, a hole. And what EMDR does is help fill that hole in where that memory is still a memory. It's just not denting my growth. It fills in the holes, and it's not something that blocks or stops my growth. Other modalities, we work on, a lot of times people have self-esteem issues. We help them learn learn whatever belief they picked up in their life, that I'm not good enough, or life's not worth it, or I'm never going to succeed. We can help challenge that and show them that, yeah, it's absolutely possible. On the same time, someone might be very prideful and don't think they need to change at all. And that flip side of that coin is we try to show people how that pride is going to take everything they have left. That pride may have served them at some point, but it's really blocking them from growth at this point. And it's taking everything. We offer interactive journaling curriculum where the person has this opportunity to go through with a group and identify, on a certain topic, write their answers and be able to share them and listen to other people's answers and have this own experience where through the journaling, it connects mind, body, spirit to the curriculum. We teach DBT, and DBT is on a simple level. DBT is, how do I not have everything be so black and white? How can I love my father, yet he was an abusive alcoholic? How do those two things, how is he not this great person that I love or this horrible person who hurt me? And we do that through what we call wise mind, where we take our logical mind and our rational mind, our rational and our logical mind and our emotional mind, and we bring them together to create what we call wise mind, to where we can make decisions with our feelings and our thoughts. And some people are very good at making emotional feelings and have very little logic, and other people are all logic and they can't connect their emotions to it. And we help people bring those together to make conscious, and how any or all of this has to do with not doing drugs. And the answer is everything. Because when I'm not doing drugs or I'm not using alcohol, I don't have that buffer to life that I'm used to. And once I've identified it's destructive and it's dependent and I'm an addict, I got to learn how to live without it. And that means I need to be able to find my compass, align my intentions with my behavior, which most substance abusers really struggle with. And that substance became the compass. So we try to help people find their compass, their inner self, their conscience, their higher power, connect back to who they really are and be able to be their best version that's in them.